Sigalagala, sigalagala na makofi. Karibu, karibu, karibu. Basi naona pale wageni wetu wamefika na tunashukuru sana wakiangalia kwanza kabisa mambo yetu ya CHVs na wakiendelea vizuri. Basi tukiendelea vizuri kabisa.
Community health volunteer has been given. Thank you. We also have, you can see the brand that is here. These are uniforms that were made by community health volunteers from Embakasi East. The community health volunteer, it is an IGA, an income generating activity. They source for the money and they were supported by AMREF. They have machines and they are looking for jobs. So they can do branding, any kind of branding. So what I wear is locally made brand from community health volunteers. We also have tools that we use to report. This one is called MOH 513. MOH 513 is a community health volunteer tool. It is used to pick data from households annually. After every 6 months, we do mapping. So we go to households and we enter data. After we do the 513, we have a 514. 514, yeah, sorry. This one, the data that is generated here will be accumulated here. So this one is a monthly tool. So they use it when they visit a household, they use this tool. After doing this, it is generated to this tool. This tool is what it is in our DHIS. It's called MOH 515. It's a tool used by ACHA. ACHA is in charge of community health volunteers. So each and every unit has this that ACHA is using to report. We also have a first aid tool. Our community health volunteers have been trained on first aid, supported by our partners, and they are given a kit that they can use in the households just when they are moving around. They also brand us and give us what to carry. Our books, all these books are meant for CHVs. So this is one of the bags that our partners have really supported the CHVs so that they can go around when they are smart. Yes.
And the 100 used to refer.
Yes.
Oh, these are manufactured.
Yes. So this is our innovation as a community.
But it is a bed, not a wheelbarrow.
We call it our community ambulance. So putting into mind that these are the available resources that we have. We use this to ferry our patients from maybe inside the corridors to the road where they can be picked with the ambulance now, with a good ambulance. So this is how we operate it. So we have our siren. So this is able to give create way. If you are carrying a patient, it is able to create way, and then we can carry our patients properly. Yeah.
To make nice ones like this one. I mean, this is a fantastic idea. Yeah, and maybe motorize it. Maybe motorize it so they can move in the big. It is actually motorized. I think it's a fantastic innovation. Yes. Well done.
Thank you.
Thank you.
Haya, tupige makofi mingi sana kwa CS wetu na viongozi wote, tukiwa tunatembea na DG. Niko na DCC wetu na ACC wetu, na ningelipenda wimbo ya taifa iweze kuwekwa sasa. Na kama uko na kofia ambayo sio ya kiserikali, tafadhali fua, na sisi wote tusimame. Kutoka hapo tupate tena wimbo ya community health after the national anthem. Please. Haya, kwa hivyo sasa tuweze kukaribisha community health haraka sana. Kwa hiyo wimbo yao kwa haraka, alafu Bwana Mohamed Abdi ukuje utufungulie kwa maombi.
Afya yetu jukumu letu. Afya yetu jukumu letu. Afya yetu jukumu letu. Tukiwa na afya vijijini tuna afya. Tukiwa na afya vijijini tuna afya. Tukiwa na afya vijijini, tukiwa na afya vijijini, tukiwa na afya vijijini tuna afya. Mawazo yetu ya kiafya yaleta afya. Mawazo yetu ya kiafya yaleta afya. Mawazo yetu ya kiafya, mawazo yetu ya kiafya, mawazo yetu ya kiafya yaleta afya. Afya yetu jukumu letu, afya yetu. Afya yetu jukumu letu, afya yetu. Afya yetu jukumu letu, afya yetu jukumu letu, afya yetu jukumu letu, afya yetu.
Makofi kwa hawa, vizuri sana. Hebu kwa hivi sasa tuweze kukaribisha Mohamed aweze kutuongoza kwa maombi.
Bismillahirrahmanirrahim. A'udhu billahi minash shaitanir rajim. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Arrahmanirrahim. Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. اللهم لا سهل إلا ما جعلته سهلا وأنت تجعل الحزن إذا شئت سهلا. وصلى الله على سيدنا محمد. آمين يا رب العالمين.
Basi tupate kuketi. Thank you so much. Tuwapigeni makofi wakubwa wetu walipofika na umeingia in good time. Allow me at this particular time to introduce Embakasi East that have a skit haraka sana ili to hand over the program iendelee vizuri. Embakasi East, the skit that they have quickly. Embakasi East, I will not call you many times because we are going ahead with the program. They have a skit. Okay, then.
Watume hospitali ili nikina waende ushauri na wapate wa mama wajawazito. Watume hospitali kliniki na waende ushauri tuwapate. Twasema twajitolea kuleta vya vijijini, jukumu letu, afya yako jukumu lako. Twasema letu twajitolea kuleta afya vijijini, afya yako jukumu lako, afya yako jukumu lako. Na
Tanishikeni huko nyuma.
watoto wakizaliwa mbele hospitali, mama wakizaliwa
Tumepeana mgongo.
twasema huduma twajitolea kuleta afya vijijini, afya yetu jukumu letu, afya yako jukumu lako. Na huduma twajitolea kuleta afya vijijini, afya yetu jukumu letu, afya yako jukumu lako. Twasema twajitolea kuleta afya vijijini, afya yetu jukumu letu, afya yako jukumu lako. Ni maji. Njaa, kiu, maji.
Hata mimi niko na jamaa.
Ai, mimi nasikia hata kujiua. Kwa nini nikiwaitisha maji hamunipei?
Mamu, nataka sasa kukufa kama dadi venye alikufa.
Ai.
Kula hizo, kesho naenda kibarua.
Saa hii na testi aji.
Odi. Mama Karo, odi.
Karibu.
Odi hapa.
Karibu.
Ni nini inaendelea hapa?
Huku hata mama amengojeka.
Unakula nini? Sasa hizi ni nini?
Mama amengojeka hajatupikia, huku hata hakuna maji.
Na hata uji nimemletea. Mama Karo, kwani leo kumeendaje? Mama Karo, utakunywa uji? Jamani, huyu mama anakufa hapa. Nitafanya nini? Shikeni uji mumpatie. Nitafanya nini?
Timi ni kunywe hii.
Wacha niite jirani. We, Mama Kanyanya.
Mama amengojeka.
Mama Kanyanya, kuja unisaidie. Hebu ona. Ni nini inaendelea hapa? Hebu ona. Sijalala leo. Mimi ni jirani. Na huyu mama ameshinda akilia mwili. Atumiangi madawa. Tutafanya aje?
Angalia kama mama atakunywa.
Huyu mama aliadhirika na atumii madawa.
Acha nikwambie. Kuna mama anatembeleanga huku manyumba huku. Na anavanga kama zile makoti za watu wakipeana polio. Huyo mama naonanga akisaidia wamama sana hapa kwetu kijijini.
Madaktari wanazungukanga mtaani wamevalia sijui nguo inakaje, ka green blue hivi.
Hao ndio nakwambia. Na niko na namba ya moja, si ni
mwita watu wanalipuanga. Kwani pesa yenye wanalipuanga wanapeleka wapi? Haji abebe huu mama apeleke.
Haki mama, usiende kama venye baba alienda.
Hello. Uko karibu nataka ukuje kwa hapa kwa Mama Kara. Mama Kara ni mgonjwa sana. Sikuja uone venye utamsaidia tafadhali. Na harakisha, naona kama atakufa. Harakisha. Sawa mama Karo. Nini inaendelea?
Mama ni mgonjwa.
Nini inaendelea hapa?
Mama amegonjeka. Mimi ni jirani yake hapo kando. Mama ameshinda akilia usiku mzima. Hata uji nimeleta hajakunywa. Watoto hawana chakula, wanakula masufuria, hebu ona, na ni vitu chafu. Hili maisha gani?
Asante. Juzi nilimpitia lakini hapo na.
Nyinyi ni wakina nani?
Sisi tunajiita community health volunteer.
Hiyo ndio kusema nini?
Kusema sisi ni madaktari vijijini.
Atapona.
Basi mnalipwanga mbebe mama mpeleke hosi. Mnangoja mama kufe kwa nyumba.
Simsaidie tu mama
yake
mwenzangu hapa na babangu alikufa.
Unaona sasa hii maisha. Mama ana bwana, mama ni HIV positive. Mama anafaa kutumia madawa na anatumia kiacha. Mtamsaidiaje? Hata sisi tumechoka.
Lakini hata asubuhi nilimwambia meze madawa hakumeza.
Haya, sikiza kwa watoto wake sasa.
Sawa, wacha nitafute anaweza tembea. Anaweza tembea kweli?
Mama hawezi tembea. Wewe vile unamuona hivyo anaweza tembea. Unaniuliza jibu. Unaniuliza jibu na wewe daktari. Si mnakuwa na gari zenyu huko hospitalini huko Mkuru.
Naomba tuweze kutafuta bodaboda iweze kumfikisha Mkuru Health Center. Wacha saa hii nipigie mtu wa boda. Lakini pesa hatuna. Mko na pesa yote
wewe. Mama kwa mara ya 3 mnalipwangwa. Msitupime wana.
Na mkichanga mkumbuke ya maji. Mkumbuke ya maji na chakula hatuna.
Okay, sawa. Habari zenu majirani. Tunaomba muweze kutusaidia na mchango kidogo. Kuna mgonjwa
kwa tena tutage na tulitaga juzi.
Tunaomba
tafadhali wewe daktari, wacha kutuchezea. Juzi pale kwa ofisi ya nyumba 10 niliona listi ya vetting. Kuna mtu anaweza vetiwa bila pesa. Bebeni mgonjwa, mmetuchokesha.
Tunaomba ni mwenzenu. Tunaomba tuweze kumfikisha tafadhali.
Nini muwajibike? Mgonjwa mpeleke hospitali. Pesa mmekula kwa sababu nyumba 10 iliwaapisha.
Tuchange. Ni kwetu tuchange pesa. Si ni jirani yetu.
Mmekuja. Haya, chukueni mtu.
Haya, leteni mgonjwa twende na tuharakisheni.
Umefika. Utanilipisha pesa ngapi kwenda Mkuru Health Center?
Hiyo ni dhao. Unajua mafuta pia imepanda namna hiyo.
Hapana, hatuna pesa tafadhali.
Wewe twendeni tutaongelea mbele. Kwanza naona mgonjwa na uje mafuta imepanda. Hiyo itakuwa ni deni. Haya, twende. Twendeni.
Basi tuwapigeni makofi tafadhali wakiwa wanaondoka.
Sisi wana huduma tumechoka kuvolontia. Sisi wana huduma
msichoke.
Tumechoka kuvolontia. Ambieni Chalusi tumechoka kuvolontia. Ambieni na waziri tumechoka kuvolontia.
Waziri amesikia, tuampigie makofi tafadhali.
Ambieni na waziri nani kwa wageni.
Yes.
Asante sana.
Kwa hivyo mimi ningependa kumwomba Mheshimiwa Mutahi Kagwe na ofisi yako, naomba msikize. Tumekuja mbele yenu kuaddress zile issues tunapatana nazo kwa hii kazi. Hii kazi ya community volunteer imekuwa first hand kusolve medical tragedies za mtaa. Volunteers ndio first respondent kudeal na issues za corona, osha mikono, nawa maji, kupeana chanjo ya measles, polio na kuidentify watoto wenye kwa malnourished, kuarifa kwa facility na kufollow up tujue vile wanaendelea. Najua mheshimiwa unajua kazi ya MACTEP. Tuna disseminate information kwa wajawazito. Mtoto akizaliwa make sure umemnyonyesha papo hapo. Maziwa ya mama ni kinga na iko na madini tosha. Lala ndani ya neti, mbu ilale nje ndio usiambukizwe na malaria. Tunapeana more information on other diseases na strategies za kuzihandle kama cholera, typhoid, HIV na TB. So mheshimiwa, taarifa ni hii. Sisi kama CHV tunaomba tupate recognition kwa serikali yako. Kazi tunafanya iko na changamoto kibao sana. Unahitaji kurifana kuandamana na mgonjwa kwa hospitali, but hata means ya kusafiri ni balaa. Credit hata kupigia cha wetu Lucy saa nyingine ni ngumu, inabidi kureverse. Safari kwa mwako karibu kusema tumewazoea. Tunafanya kazi hadi usiku na security yetu sometimes iko compromised. Naishi na virusi vya ukimwi pia. Nimejitolea kusaidia wenzangu, lakini stigma na discrimination ni nyingi hadi nashindwa kuendelea na hii kazi. Raia kwa community nadhani sisi tunalipo kufanya hii kazi, but tunajitolea, tunarifa wagonjwa kwenye mental health, but sisi hatuna wa kukimbilia. Suicidal thoughts zinatupandilia, kuandikisha vulnerable for support kama cash transfers, food reliefs na support zingine sisi huwa to benefit. Yet sisi ndo tuna visit household ku identify na kuregister wale in need, yet sisi tunaambiwa tusijiandikishe. Tueleweshe basi definition ya vulnerable ni nini, na sisi sote hatuko kwa payroll. Imagine kutuambia tusiregister na account yetu kila mwezi na read zero. Tunaomba mheshimiwa utu recognize kama vile Kisumu wako kwa rada JCHV. Imagine tu kila mwisho wa mwezi unapata SMS kutoka Nairobi County, itakuwaje? Hii itakuwa motivation tosha na ita help sisi kufanya kazi yetu kwa urahisi na utaratibu. Hizi changamoto ni mingi, so tunaomba mheshimiwa Mutahi Kagwe utupange kama watu wako kwa ground. Tutashukuru sana juu afya yetu ni jukumu letu. Shukran.
Asante, makofi, makofi, makofi. Asante sana, asante sana.
Tumechoka kuvolontia.
Asante sana, asante sana. Voluntarily yenyu imesikikwa na siku ya leo mambo itakuwa mzuri. To our chief guest, our CS, allow me just to bring a group of Dagoretti South, just a song. Then from there we embark on our karibuni sana. Tuwapigeni makofi tafadhali wakikuja. Karibu sana wana afya. Na mkwe kwa haraka kidogo. Thank you so much.
Afya, oh afya. Afya, oh afya. La 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 la. La 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 la. La 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 la. La 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 la. La la oh la la.
Jukumu letu.
In front of you are community health volunteers from Dagoretti, ready to present a song promoting community strategy. Welcome.
Yetu ya Kenya, leta amani, maendeleo tumeona, barabara zatengezwa mashinani, maji tumepata hapa Nairobi. Pongezi ya Nemesi kwa kazi mnayofanya, pongezi ya Nemesi kwa kazi mnayofanya. Kazi tumefanya vijijini, watu watujua mashinani, kianza kuhesabu manyumba, kuhesabu watoto na wajawazito. Pongezi ya Nemesi kwa kazi mnayofanya, pongezi ya Nemesi kwa kazi tunayofanya. Kazi tumefanya ya kutolea bila kusukumwa na mtu yeyote, tembelea nyumba kwa ingine sio rahisi, ni hekima. Pongezi ya Nemesi kwa kazi mnayofanya, pongezi ya Nemesi kwa kazi mnayofanya. Sisi wahudumu wa kujitolea tunasema Nemesi endelee kuwa Kikuru kaunti ya Nairobi kwa kutenga bajeti ya CHV. Pongezi ya Nemesi kwa kazi mnayofanya, pongezi ya Nemesi kwa kazi mnayofanya. Maradhi yapungua vijijini kama kuhara kwa shoko na mengine, kuhakikisha walioko kwa madawa wamefuata maagizo ya daktari. Pongezi Nemesi kwa kazi mnayofanya. Pongezi Nemesi kwa kazi mnayofanya.
Tuwapigeni makofi tafadhali wakiwa wanateremka. Tumesema asante sana kwa mambo yenu. Very good.
Social distance. Na tuchanjwe.
Very good.
Mama Deno, kwa kazi mnayofanya. Pongezi Nemesi kwa kazi mnayofanya.
Basi tukiwa tunaondoka, tafadhali tuwapigeni makofi wakienda. Wamewimba wimbo mzuri sana na tunataka kusema ni asante. Fungua hii. Asante sana. Mkiwa mnaondoka, tunataka kusema ni asante kwa hao vikundi viwili kutupatia a small entertainment. Our chief guest, allow me now to invite the head of community health services, CHVs, Madam Judy, to take over the program. Tumpigeni makofi. Makofi wa Madam Judy kabisa. Karibu sana, Madam.
Afya yetu. Si leo ni siku kubwa. Si ni harusi yetu. So tunashukuru kukuwa na wageni wetu. Kwa hii wakati nataka kuita senior DCC Lang'ata, Bwana Henry ndio aendeleshe. Na karibuni na msikie mko nyumbani. Asanti.
Wapile mtu wa Mheshimiwa Waziri wa Afya Honorable Mutahi Kagwe, Deputy Director General wa NMS Mr. Kang'ethe Thuku, Waziri wa Afya katika kaunti ya Nairobi, Director wa Afya Bwana Ouma Oluga, Madam County Commissioner, all protocols observed. Wananchi watukufu, afya yetu, jukumu letu. Asanteni sana. Ningependa kuwakaribisha nyinyi nyote. Mheshimiwa Waziri, tunashukuru kwa kukubali kuwa mgeni wa heshima katika hii sherehe ya siku ya leo ambao ni muhimu sana katika kulaunch hii Nairobi Metropolitan Community Health Services Act. Na mimi kwa sababu ya wakati sitachukua muda mrefu, nitachukua jukumu kualika wahusika kadha wa kadha ili waweze kusungumuza, ndiposa baadaye tutaendelea na program. Ningependa kuchukua nafasi hii kumuita representative wa community health stakeholders, Dr. Meshak Ndirangu, County Director Amref. Karibu daktari. Makofi kwa daktari.
Honorable Senator Mutahi Kagwe, Cabinet Secretary, Ministry of Health, Mr. Kang'ethe Thuku, Deputy Director General NMS, Dr. Yaron Wallman, representing UNICEF today, Dr. Ouma Oluga, Director of Health Services, Nairobi County, members of the Health Committee, County Executive Committee members present. I go to see you, Dr. Hitan, Chief Officers, all partners represented, other dignitaries, distinguished guests, and all protocols observed. Good morning. It gives me and all community health stakeholders represented here today great honor and privilege to join you here at the official launch of the Nairobi City County Community Health Services Act 2019. And I would like to acknowledge that there are several community health stakeholders here. We're only speaking on behalf of them. I've seen World Vision, Carolina for Kibera, Save the Children, Shofco, and also Living Goods, and all the others who are represented here today. Receive greetings from our group CEO, Dr. Githiji Getahi, who wanted to be with you today, but who was not able, and you know he is an advocate of the rights of community health volunteers and workers. This event is a remarkable opportunity to celebrate a major milestone made by the Nairobi Metropolitan Services in institutionalizing community health services at the policy and practice level. On behalf of all partners supporting the implementation of community health services, Amref Health Africa heartily congratulates Nairobi Metropolitan Services, the Nairobi City County, for joining 8 other counties in enacting the Community Health Services Act. Makofi kwa NMS. The other counties that have achieved these historic milestones are Turkana, Homa Bay, Kajiado, Busia, Murang'a, Samburu, Kisii, and Bungoma. Once again, we say congratulations to Nairobi and to the 8 other counties. On the same note, we thank and commend the National Ministry of Health with the leadership of Honorable Senator for providing the overall policy and strategic framework for community health services that today counties are relying on. So thank you so much, Waziri, because the overall policy guidance is what counties are relying on to develop these acts. Distinguished ladies and gentlemen, the County Community Health Services Act gives effect to the provisions of the Article 43(1)(a) of the Kenya Constitution and provides for the establishment and the delineation of community health service units within the county for effective and efficient delivery of community-based services. The Act provides a framework for the county to reap a number of benefits, including enhanced coordination of community health services, improved community engagement, sustainable financing, and most importantly, ensuring the rights of community health volunteers and community health services personnel are protected, including health, safety, training, and stipends. Distinguished guests, ladies and gentlemen, the County Community Health Services Act is a golden step towards enhanced primary health care services and the attainment of universal health coverage. As you remember, in 2017, our President, His Excellency Honorable Uhuru Muigai Kenyatta, made UHC a priority as part of the Big Four agenda to ensure all Kenyans can access the services they require without experiencing financial hardship. This act by NMS reinforces the aspirations of the Big Four agenda. Community health services play a critical role for the delivery of primary health care and for the achievement of UHC. For example, they help households to understand and enroll into NHIF for financial protection. They visit households, like you have seen here, and provide timely preventive and promotive services, especially information, like they have done during the COVID-19 pandemic after we trained them through their mobile phones using the LEAP technology. They are trusted by communities and add immense value in strengthening the linkage between health facilities and communities, including referral as well as flow of data for decision making. They contribute directly to improving health outcomes at household level, including in core areas like maternal health, child health, TB case finding, and HIV treatment adherence, among others. Indeed, community health volunteers are a lifeline for hundreds of thousands of people who would otherwise not have access to health care. Ladies and gentlemen, in Nairobi, Amref Health Africa has worked under the leadership of the County Health Executive and Management Committee to strengthen community health services in several ways. These include building the capacity of CHVs, household mapping and registration through digitized MOH tools, and we commend NMS for adopting technology, identification of eligible households for NHIF registration, promoting quality improvement of health facilities and response to public health emergencies like COVID-19 and cholera outbreaks. As you know, at Amref Health Africa, we strongly believe that health is largely made at home, in households, and repaired in hospitals. And that is why we support counties to do all they can to improve community health services. So, ladies and gentlemen, as we forge ahead strengthening community health services, let us be conscious of the challenges that community health volunteers face. These include irregularity, inconsistency, and inadequacy of remuneration, which often stifle motivation and retention. These are further worsened by the weak coordination of community health volunteers, causing fragmentation of support and sometimes wastage of resources through duplication of effort. To address these challenges, as stakeholders, we all need to work together to establish common mechanisms for coordination of community health services. And a good example is the establishment of community health service bureaus that a number of partners have come together, and Amref is helping coordinate to establish community health bureaus in 4 counties. As I get close to the end of my remarks, let us remember what I just said, that community health volunteers are a lifeline for hundreds of thousands of people who would otherwise not have access to health care. We therefore call on the remaining 38 county governments that do not have CHS acts to emulate NMS and the Nairobi County government and develop and enact the CHS bill to provide the framework for better coordination and financing of community health services. So that's the direct challenge to the other 38 counties to see the advantage of having these acts so that these community health volunteers, their rights are protected, their capacity building, and the services that we give to them so that they can support households. We also call on all 47 county governments to do all they can to increase sustainable and equitable domestic financing for community health as part of primary health care. In addition, we encourage and challenge counties, all the 47 of them, to up the use of technology, recognizing that community health workers rely a lot on the mobile phone. How can we support community health workers to learn, to share data, to collect data using the mobile phone? And we are here to support such initiatives. We also call on all the 47 county governments to support in actualizing innovative models of ensuring that there are common mechanisms for coordinating community health workers, such as community health bureaus being tested in 4 counties. And finally, and I truly want to thank community health workers for the role they have played in helping slow down the pandemic, in helping the country be where it is, with their leadership was really recognizing that value community health workers have added. We call on the 47 county governments to do more to improve preparedness for public health emergencies by including community health as a core aspect of preparedness, because we have seen community health workers can do so much in terms of community-based surveillance, case-based surveillance, as well as timely household behavior change communication, because they are trusted agents of society. Distinguished ladies and gentlemen, once again, Amref Health Africa, we congratulate all of you for your belief in the work that community health workers do and the impact that they create in the lives of people in Kenya. We proudly reiterate our commitment to support counties to enact the CHS bills, the remaining 38, because we know that by doing so, we are voting yes for PHC, for UHC, and for health for all. Thank you, and may God bless you. Thank you very much. Thank you.
Nairobi, Madam Pasaris. Karibu sana. Wakati huu ningependa kumuita Dr. Ken Odede, CEO wa Sofco, akuja hapa tusumbusie. Daktari, karibu.
Afya yetu. Thank you so much, Honorable Mutahi Kagwe, for being here. This is a very special occasion. And as someone who grew up in Kibera, huko Kibra, tunaelewa hii maisha. And you remember during COVID, Sofco imekuwa ikifanya nyingi kazi. Si ni kweli? Chakula. There's a lady here called Judy. Judy really cares so much about you. Kusema kweli. Every time, Kennedy, daktari. Judy, today is a special day because it's not about handouts. We are making it into an act, into a law, so that at least upate airtime. Hao watu wanafanya kazi, mheshimiwa, kwa community sana. Nikiwa mdogo Kibera, wanaitangwa daktari. These are our first doctor before tujue madaktari wengine. Na ni aibu sana wakifanya hii kazi na wako na njaa. Mpaka mnasengenywa kwa community. Ati ni uongo na bala umeng'ara. Lakini leo kusema kweli tumeona kazi ya NMS. Si kweli? If there's one thing you can give us for this year to make these community health workers iwe pale ndani ya kwamba they'll be getting that money. Hata kama ni kidogo aje. We also have to know that is not enough. We are asking our partners, msiwasahau. Please, let's keep on supporting them. And lastly, today is a special day, but I'm so sad that this is the capital city of Kenya. Tunakuwa last. So today that Nairobi has taken the lead, I hope Kenya mzima, the same thing will happen. A long journey starts with a single step. I want to thank our partners. I know it's not easy to do this, but we made it possible. Asanteni sana. God bless you. Afya yetu. Thank you.
Asante sana daktari. Wakati huu ningependa kumuita Bwana Manisha Zaman, County Representative wa UNICEF, akuja hapa sumuza. Karibu. Oh, welcome.
Honorable Mutahi Kagwe, Cabinet Secretary, Ministry of Health, Director General of the Nairobi Metropolitan Services and Deputy Director General, Madam County Commissioner, representative from development partners and non-governmental organizations, distinguished guests, community health volunteers, ladies and gentlemen, all protocols observed. On behalf of the UNICEF country representative, Dr. Manisha Zaman, I am extremely pleased to be here this morning and feel a great privilege in joining this festive day. I hope that everyone present are doing well, keeping healthy and safe, themselves and their families as well. My colleague from AMREF has already expanded and provided many inputs covering many different aspects, so I will try being brief, complementing a few additional elements. First, on behalf of development partners and UNICEF, I would like to start by appreciating the effective response that the government of Kenya has taken in the fight against COVID-19, including the COVID-19 vaccination rollout to protect the people of Kenya against the outbreak. And this effective response, under the leadership of the Ministry of Health, has been very closely reflected in the commendable response by Nairobi Metropolitan Services, which has been and still is the epicenter of the outbreak here in Kenya. The leadership of the government of Kenya in providing policy guidance and all counties, including Nairobi Metropolitan Services, is highly appreciated. While COVID-19 has really had disastrous effects on the health, the livelihoods, and the general well-being on many individuals and their family and community members, including children and women here in Kenya and in Nairobi, it has presented an opportunity for increasing the resilience of the health system and has demonstrated once again the importance of a strong and functional community health system. We know that community health volunteers are supporting community-based surveillance to promote prevention measures and referrals, as well as supporting home-based care and treatment for positive COVID-19 positive patients. We know that as community health services and the community health volunteers, as they were important in the COVID-19 outbreak response, their importance in the day-to-day delivery of community health services to children, women, elderly, and all members of the community is of immense importance and cannot be overstated. This is especially important in supporting the attainment of universal health coverage that the government has already invested in community health services and primary health care even before the COVID-19 outbreak. The extremely ambitious targets of the government targeting over 90% coverage of community health services across the country, including here in Nairobi and its metropolitan services, is highly appreciated by all development partners. And we would like to highlight that Kenya is currently being appreciated as one of several leading countries in sub-Saharan Africa in the way that it's really recognizing community health services as a critical pillar of the health system, critical for achieving universal health coverage. As mentioned already by my colleague Dr. Meshka from AMREF, Nairobi Metropolitan Services has joined the league of 8 counties within Kenya who have already launched the Community Health Services Bill and Act to ensure that community health volunteers and community health services are systematically appreciated, supported, and remunerated in order to perform their role. Distinguished guests, allow me to share a little bit of information regarding UNICEF. UNICEF is a United Nations agency responsible for advocating for children's rights and working in over 190 countries across the world to protect the rights of every child, including here in Kenya. UNICEF mission and mandate is to advocate for and support ensuring that all children enjoy all their fundamental rights, that all their fundamental needs are met to expand their opportunities, to ensure that they reach their full potential, and of course, as part of that, ensure that they have access to life-saving health services, including community health services. Given the multiple deprivations children and risks that children are facing, and households and communities are where the journey to achieve the children's rights begin. As such, UNICEF has a focus in supporting governments at national and subnational level in reaching every child, including through the Community Health Services platform. In Kenya, UNICEF, together with other development partners and other United Nations agencies, UNICEF is supporting the Ministry of Health and counties in strengthening community health services as a foundation for strengthened primary healthcare services. UNICEF Kenya has supported and will continue supporting the Ministry of Health and the counties in the rollout of the Community Health Policy 2020-2030 and the Community Health Services Strategy 2020-25. We are also supporting Nairobi Metropolitan Services and multiple other counties to establish and operationalize community health services acts and bills, and within that, operationalize community health units, as well as supporting the implementation of these bills to ensure that community health services are implemented in a sustainable manner. Here in Nairobi, together with other development partners, UNICEF Kenya has been part of the team that provided support towards the development and the approval of the Community Health Services Act and Bill, which is being launched here today. That includes also support in the training and deployment of community health volunteers who have been provided with data reporting registers and bags, together with visibility material, reporting tools, in order to support them to perform their duties. Today is a festive day, is a special day that we are really proud of contributing and joining to, together with other development partners. We would like to thank the Nairobi Metropolitan Services and the Ministry of Health under your leadership, Waziri, in reaching this special day today here in Langata. Ladies and gentlemen, on behalf of the development partners, I would like to congratulate Nairobi Metropolitan Services for passing the Community Health Services Act and Bill, and for the commitment to continuously operationalize it by launching it today. The launch today is only the beginning of the journey, and Nairobi is, as I said, joining the group of the 8 counties that have recognized the importance of community health volunteers as community health service providers at level 1. We would like to congratulate Nairobi Metropolitan Services for putting measures in place to allow the volunteers to be supported financially and through supportive supervision to stay motivated and regularly receive the supplies and commodities that they need in order to perform their works, including job mentoring and coaching, to be able to effectively, efficiently, and as we have seen this morning, innovatively, to continue saving lives. In conclusion, UNICEF is glad and proud, together with other development partners, to be part of this joyous occasion, and we are looking forward to being part of this journey together with other development partners to ensure that all people in Nairobi, in all parts of Nairobi and all parts of the country, have access and receive high quality preventive, promotive and curative health services close to home at the community and household level, with a very strong support and well-established linkages to the primary healthcare facilities. Thank you very much, ladies and gentlemen, and once again, congratulations to the Nairobi Metropolitan Services for this great achievement. Thank you.
Thank you very much, Mr. Manisa Saman, country representative for UNICEF in Kenya. Mheshimiwa Waziri, wakati huu ningependa kuchukua nafasi hii nimuite CEC in charge of health, Bwana Hitan Machefdia, akuja asumuzi na achukue program ile imepaki pande hiyo na aliko wengine. Karibu. Karibu Mheshimiwa.
Thank you very much, Bwana CS my brother Mutai Kagwe, DDG, Mr. Kangete, Nairobi Women Rep, my sister Esther Pasaris, my chair of Health Committee in Nairobi County, Peter Warutere, our CS is also here, Nairobi County. The sponsor of this bill, Mheshimiwa Mbono, is also around. Our partners, UNICEF, other NGOs, Shofco, Karibuni Sana. I want to make a small comment before I take the program forward. When I was appointed Waziri for Health in Nairobi, this was the first bill that I started with. And I think Judy can be my witness how we fought this war. It was a war, and Judy is witness how we canvassed until somebody lost the original bill, and we had to restart everything. We had targeted to be the first county so that the other counties follow us. But anyway, we have reached where we have, and I thank the Assembly, the partners, even the national government assisted us, UNICEF, the executive, the CS was also, he was in health, you know, now he has been promoted, but he was actually in health before he became the CS. So he was also instrumental in this bill. So I would like to appreciate them, and we have reached where we are because of all this collaboration from everyone. And Bwana Kagwe, you know, even this war we are fighting now for COVID, if it was not the CHVs, we would have not reached where we have reached today. They are a very, very important part of the primary health care, and for us even to succeed in UHC, we will need them. So next year, budget, I'm going to again defend and increase the budget for CHVs. So I will request our chair, please support me at that time, so we give them what is due to them next, also in the next budget. So with those few remarks, I would like to now call our chair, Mr. Honorable Peter Warutere, to make his remarks.
Afya yetu, jukumu letu. Asanteni sana. Bwana CS Health, Mutahi Kagwe, our Deputy Director General, Kang'ethe Thuku, CEC, Health, various management partners, our Women Lab, Director Health Services, distinguished guests, ladies and gentlemen. It gives me a great honor to join the rest of the NMS and County Executive Fraternity today to witness this great milestone. From the outset, let me commend the sustained working relationship witnessed between the Directorate of Health Services, that is the NMS, County Executive Committee member for Health, and the Committee on Health Services, together with the Finance, Budget and Appropriation Committee within Nairobi Assembly. This cooperation has ensured that the piece of registration, which is the Nairobi City County Community Health Services Act 2019, was gazetted, and a significant budgetary allocation set aside in the financial year 2021-2022 to jumpstart the process and this implementation. This is actually the essence of this launch and of our being here today. As a city county, we have committed to remain as a role model to other counties, especially on matters health. As we witness the operationalization of this Community Health Services Act, that is intended to improve healthcare services in all our 17 sub-county units, the Nairobi City County Assembly remains committed to ensure a continuous budgetary allocation to the health sector to improve services both at the grassroots and at the national level. That is in tandem with the provision of Article 43(1)(a) of the Constitution of Kenya 2010. We want to see community health volunteers, that is CHVs, motivated through stipends that should be paid in time,
so that they can take their functions effectively, which shall, among others, to educate and help communities prevent common ailments such as diarrhea, pneumonia, and malaria, among others. As the chairman of Health Services Committee, I must reiterate the good work the NMS and the executive is doing, especially in construction of additional new county health facilities that will help to decongest Kenyatta National Hospital as our honorary referral hospital. And indeed, it is gratifying to see hospitals built in informal settlements to serve the least vulnerable populations. Let us now confront the bottlenecks that delay the timely supplies of the essential drugs to these facilities so that we can ensure our people live decent lives. In conclusion, this launch is a good step in the right direction in achieving the universal health coverage that is also in line and tandem with our President's Big Four agenda. Let us not tire to serving our people the best way we can. I would like also to bring greetings from my fellow honorable members of the Committee of Health Services, together with those of Finance, Budget and Appropriation Committee, whose unanimous efforts has made this phenomenal launch of Nairobi City County Community Health Service Act 2019 a reality. With that, we are and will always remain forever grateful for this kind act. With your permission, Honorable CS, allow me to just allow Mr. Pius Bono, the gentleman who was, through efforts, made this act be what it is today.
All protocols observed. My name is Pius Maura Bono, MCA Zimmerman, and the sponsor of the bill that brought us where we are. Now we have the act. Bwana Waziri, it was not easy. It started with the statement that I brought in the assembly, in the first assembly. It was not responded because the statement has or had budget implication. It was responded 2 months towards our exit, and I was really disturbed. I promised the assembly that if I come back in 2017, I had to bring the motion. And Bwana Waziri, in 2017, when we were elected back, the time was very short. But I made sure in February 2018, it was the first motion in the assembly. It is a long journey. Today, I'm calling it a seed of faith that we are going to have a bounty harvest today. Thank you, the CHVs. We have gone a very long journey with you. During the initial stage, I did a lot of research. I called you. You came on board. It was not easy. I want to thank everybody that today we are all excited, all of us, that we are going to harvest whatever we planted some few years ago. Thank you.
Asante sana Mheshimiwa Mbono. I would like to now invite Dr. Oluga to take us forward to the next phase of the program.
Waziri, Mheshimiwa Mutahi Kagwe, the Deputy Director General, our beloved woman rep for Nairobi, County Secretary, Committee Chair for Health, the partners represented by UNICEF Country Representative and the Country Director AMREF, our good friend Odede. We've been meaning to meet in Kibra. Now we meet here. Mine is to welcome you, Waziri, to this auspicious occasion. Hawa watu ambao wako hapa ni community health workers na wamekupenda sana. More than 2 weeks ago, nilikuwa nao pale Lang'ata, si ndio? Nikawaambia waziri utakuja, na mimi ningependa kushukuru sana on their behalf kwa sababu umeitikia wito wao na umekuja. Si niliwaambia waziri atakuja? Amekuja ama hajakuja? Si ndio? Sasa sisi tungependa sana kuwashukuru for that, for supporting the community health work, and especially because waziri, some of them have met you before in several occasions in Zimmerman and also there in Lang'ata when you are launching the services. We are very proud as the Directorate of Health in NMS to have achieved this objective. We want to thank Bwana Pius, who sponsored the bill. We want to thank the CEC Health. We want to thank the county secretary and the county leadership, because within a very short time, the bill had been lying without gazettement, and within a very, very short time, Waziri working with the county secretary and our good friend Warutere, who is the committee chair, we gazetted this bill in a record 7 days after it had been on the shelf for almost 2 years. And beyond this act helping the community healthcare workers to get a framework to be motivated, to be paid a stipend, to be remunerated, it also helps us as NMS to make them accountable, because wakati mwingi waziri wakienda pale kijiji vile ulikuja na sisi pale Kibra wakati wa polio, hao ndio walikupeleka waziri when tulikuwa tunafanya chanjo. Na ni muhimu sana wananchi wajue huyu ni community healthcare worker na amepewa tag, amepewa identification na serikali. Ndio tusipate pia wale ambao hawana recognition ama wale ambao wanataka kudanganya wananchi. So beyond ile wanataka kulipwa, sisi pia inatusaidia kwa sababu inafanya kazi yetu iwe rahisi ku identify katika ward ya Kibra ama sub-county ya Kibra ama Lang'ata. Tuko na ile orodha ya wafanyikazi wa afya ama CHVs ambao tunaweza sema hawa ndio wetu, so that if anything goes wrong, kwa sababu waziri hawa wanaenda mpaka kwa households ya watu, so it is very important that we are also accountable for them and that they are doing the correct thing, that they are well trained, that they are disciplined, that they are not the cause of other issues in the community. Mine, Waziri, is to thank you very much for coming and to thank everyone for coming and to thank you for the work ambao mnafanya, na sisi tutaendelea kufanya hiyo kazi. Kwa sahihi, kwa sababu ya muda, ningependa kualika County Commissioner pia aseme nanyi kidogo, alafu tuendelee na program.
Thank you, Director. Our chief guest, Mheshimiwa Honorable Mutahi Kagwe, the Deputy Director, NMS, my brother Kang'ethe Thuku, the Women Rep, Nairobi, Honorable Pasaris, the Chairman of the Health Committee from the Nairobi City County, the Secretary, the Nairobi City County, Dr. Musumba, all my colleagues, civil servants present here today, community health workers, habari ya asubuhi. Na wasalimia, habari zenu, afya yetu, jukumu letu. Asante sana. Niko na furaha sana kuwa hapa siku ya leo. kwa sababu kazi ambayo hawa ambao wamekaa mbele yetu hapa waziri ni muhimu sana. Tangu mimi nikiwa mtoto mdogo nimeona wakifanya kazi na wanafanya kazi muhimu kabisa. Wakati niliona ile act last week, wakati niliambiwa kwamba tutakuwa na mkutano huu, nikaona kwamba county government imefanya kazi nzuri sana, na ningependa kuchukua nafasi hii kuwashukuru wote ambao walihusika kuwa na hii sheria, ili kazi ambayo mnafanya iwe inatambulika katika sheria za county, muweze kupewa kitu ambacho pia kitawamotivate kufanya kazi ambayo mnafanya, na pia muwe accountable, kwa sababu kuna wengine ambao labda hawafanyi ile kazi ambayo inatakikana, lakini tukiwa na hii sheria tunaweza tukajua ni nani ambaye hafanyi kile ambacho anafaa kuwa akifanya. Nimeona ya kwamba tukiwa na hawa wote kazi yetu itakuwa rahisi, na ningependa kudhibitisha hapa mheshimiwa ya kwamba wakati tulipata hii ugonjwa wa COVID hapa Nairobi, hawa wametusaidia sana, kwa sababu watu wengi wakiwa wagonjwa kwa vijiji, hata wengine hawakuwa wanajua shida ni nini, na wamefanya kazi kubwa sana, na ningependa kuchukua nafasi hii kuwashukuru sana na kusaidia serikali. Mmetusaidia sana kuweza kuattain one of the big 4 agendas ambayo ni kuattain healthcare, na muendelee na hiyo kazi nzuri ambayo mnafanya. Ya mwisho ningependa kutoa hakikisho langu hapa ya kwamba national government itafanya kazi pamoja na hawa, kwa sababu nimeona kwamba machief watakuwa mmojawapo wa komiti ambazo zitakuwa zikifanya kazi kule mashinani. Ningependa kuhakikishia ya kwamba national government iko tayari kufanya kazi na nyinyi kuhakikisha ya kwamba tumeateni universal healthcare katika nchi yetu. Nikimalizia, ningependa kuwakumbusha ya kwamba tumeanza kwa ruhusa yako waziri, nikubali niseme ya kwamba tumeanza kuandikisha wapigaji kura. Najua joto la siasa limeanza. Tafadhali mjulishe wengine kwamba kuanzia leo wale ambao hawana kura wachukue kura zao. Vile vile tumeanzisha program ile tunaita crash program, ili wale vijana ambao hawajachukua vipande waweze kuchukua vipande, ili pia hawa waweze kuchukua kura, ili waweze kupiga kura mwaka ujao. Tutakuwa tukiwa na mobile registration programs katika Nairobi. Kwa hivyo mkiwasiliana na machifu wenu mtaweza kujua mahali ambapo tutakuwa tukipeana vipande. Ya mwisho pia ningependa kusema ya kwamba tunaenda kuanza phase 2 ya kupeana huduma cards. Wale ambao hawakuweza kuchukua huduma cards tutawapatia hivi karibuni. Kwa hivyo tujulishe watu wetu, na wale wengi, nusu ya watu ambao wako hapa Nairobi waliregister for huduma card na hawajachukua. Ni mwito wangu wale ambao waliregister, tafadhali muweze kuenda kwa ofisi za DCC muweze kuchukua kadi zenu. Na mwisho kabisa ningependa kusema kwamba tukishirikiana na ofisi ya mheshimiwa GAF na NMS tuko na ICAM ambayo imeanza leo. Screening yake inaendelea katika zile hospitali ambazo zimefunguliwa juzi. Tutakuwa tukifanya hiyo screening ili wale ambao watapatikana na ile ambayo inaitwa cataract waweze kufanyiwa surgery bure kuanzia tarehe 14. Kwa hivyo tujaribu kueleza watu wetu waende kwa zile hospitali ambazo ziko karibu waweze kufanyiwa hiyo screening. Asanteni sana kwa kunisikiza.
Mheshimiwa County Commissioner, sasa ningependa kualika mama wa county Mheshimiwa Esther Passaris akuje waseme kidogo.
The CS Health, the Deputy Director General NMS, the County Secretary of Nairobi County Government, UNICEF, the CEC for Nairobi County Government, my County Commissioner, Dr. Omar Luga, all protocols observed, the sponsor of the bill, Pius, as well as the chair of the Committee of Health at Nairobi County, my CHBs, hamjambo. Hamjambo tena. CS, I really decided to come here today because this is an important landmark day for our country. The fact that we are actually recognizing through law, through law, the work and efforts of the community health. I don't want to call them volunteers because from today they become workers. Sindio? Munaitwa workers sasa. Sindio? So I don't want to call them volunteers because we have taken advantage of these hard-working Kenyans who started universal healthcare in the grassroots. Universal healthcare ilianza na nyinyi. Nyinyi ndio mulianza kwenda door to door. Mukipeana polio, mukipeana education, mukitoa wagonjwa mukiwapeleka kwa hospitali. With their own might, with their own finances, mumefanya kazi. Nataka kuwapongeza sana my community health workers. Leo ni siku yenu. And Nairobi County Government, together with NMS, what you have achieved today, together with the mover and sponsor of this bill, together with the health committee, from the previous government to the current one, to now last 7 days, when we work together, we work with vision, we can achieve anything. Because something that has been sitting, gathering dust, was moved within 7 days. Now this is what we have to give a big clap to Lieutenant General Badi. He has brought the military discipline into how we do things. Ukienda kwake umwambie tunataka kufanya hivi, Lieutenant General Badi says, this, let's get it done. He looks at it as war, and we have to win the war. So he's not here today. He traveled on work to the US, but he sends you all his greetings and his blessings as you move forward as employees and workers of the Nairobi County Government. I also want to bring you greetings from the governor, Acting Governor N. Kananu, who also traveled to the US, and she said to tell you she is standing with you and she's supporting you, and I know this is a money bill. We will need to find the resources. If we don't have resources, let us not cost our resources for the community health workers. Let us budget for it. Now I also bring you greetings from my party leader, Raila Amolo Odinga. Munapokea? He went to Garissa today, but he told me if he was not in Garissa, he would have been here, because he knows the agenda of the president for universal health care is very, very important. And he knows we cannot achieve universal health care without the support of the community health workers. From my office, GAF, during the pandemic, CS, we tried to look for how we can connect with the community health workers, because we wanted to give them money, and we gave them 3 million shillings spread to 30 registered groups. But the thing is, we do not know how many of the groups were genuine, how many were wakora. And that is because of lack of data. So we need to make sure that we have a platform where you can know, it's not just the uniform and the card. Wajua watu wanaweza kutendeza hii uniform haraka town. Waanze kutembea kwa mtaa waseme mimi ni community health workers, waanze kuibia watu, waharibu sifa zenyu. So we need to find a way beyond the uniform, beyond the ID card, on a well-documented app or website where somebody can quickly Google or send a number and say that is this my community health worker? Is this the person who I should be consulting? Because if we don't do that, then we will fail to help the genuine community health workers on the grassroots. Kama wewe uko huko chini na unataka kupata hii kazi, go through the training, go through the understanding, and then be allocated your area. We have Nyumba Kumi, we have Huduma Number, we have a way of working, and that structure should be known and disseminated through a lot of advertising, a lot of public participation, a lot of civic education, because if we don't do that, we will fail. I, for instance, have 2 victims that I'm helping right now. There's a young boy called Shadrach who is paralyzed from neck to bottom. paralyzed completely. He had an accident, he's completely paralyzed. He goes through tremendous bed sores, a lot of pain. The mother cannot anymore lift him because he's now almost 18. This is where we need the community health worker to be assigned to that boy to be able to help that mother. Now, when you assign a community health worker to a family, and it is a job that requires 2 or 3 visits a week, we have to look beyond the standard stipend. The standard stipend cannot work. I have a burn victim in Kayole right now. A little girl who got burnt, she fell into a pot of oil. She got burnt her whole body. I ended up going to that house. How do I find the community health worker for that particular house in Kayole to be able to go? So we have to find a way to assign. I was in the UK when I saw the community health workers and how they work. In the UK, you have people who are old, and they cannot light the heater on their own. They cannot know, and you know, they lose a lot of people during the cold winter season. So they have such a standard way of working that a community health worker knows everybody in the area who has cancer, who has diabetes, who has hypertension, who has physical disability, who requires assistance even with food or with vitamins or with medicines. And that person is allocated the jobs. So we have to go beyond the law, and we have to recognize that our people are suffering. Our people are suffering. They don't know how to get help. A mother with a disabled child is reaching a point of exhaustion and mental depression, and she needs help. So these are the people who can help. And for us to get them to help, we need to be able to allocate them assignments. And you are paid according to the assignments you've been given. Because if you're going to say, we're giving you 2,000, for instance, and then you expect them to look after 500 people, it's not possible. It's not possible. So, kitu nataka kuambia, wajua mumejitolea kufanya hii kazi, na mumefanya miaka nyingi bila kulipwa. Na hii kazi mumefanya na roho yenu safi. Muendelee hivyo. Wale ambao wanataka, you know, the UK is looking for nurses. The UK is looking for nurses. Wale ambao wanataka kurudi shule kusoma, please apply for bursaries for my office. We sponsor you. CS, is there a way that we can look at the qualifications of these people here, the community health workers, and see those who can be sponsored? Because hawana pesa ya kulipa. Mimi nikipatia 10,000, hawawezi kwenda shule. Is there a way that our government can give them scholarships to go and study? Full scholarships. So that they can elevate, alafu UK wakisema wanataka watu kwenda kusaidia huko, they can go, they can get exposure, they can get training, they can come back and serve our people. So there's a lot more than just launching a law. There's a lot more than just launching a law. We have to deliver universal health care, and we cannot without these community health workers. County Commissioner wangu amesimama hapa amezungumza habari ya iCamp. Bwana CS, I'm so proud of you. We are bringing doctors from Spain together with MA Math Charitable Trust. They're going to spend over 100 million to perform 500 surgeries of cataract for our people for free. We're working with NMS, Dr. Oluga and his team, and we're trying to make sure that we can identify the right people. Today, we're doing the screening in Kariobangi North Health Center. The operations will be done in the 2 hospitals opened by His Excellency. The screening is happening right now, but we need to go mashinani. Tutafute wale watu ambao wako na shida ya macho, blood vision, na waende wafanywe screening, ili kama ni cataract, wafanywe hiyo operation. Na wakifanywa hiyo screening, we will know through the data ni nini ingine inawasumbua, ili tuweze kuplan how we can bring expert doctors to be able to work with our teams and to be able to do medical camps. Medical camps will help our people. 500 cataract operations for free, conducted by the Spanish doctors that are going to come, will help also our people learn so much about the new technology. So I really hope, mukitoka hapa leo, tafadhali wale munajua ambao wako na shida ya macho, angalieni, we will share with your platforms, angalieni pale tutakuwa na screening, mutume hawa waende wafanye screening, mufike hapo mufanye hiyo kazi, kwa sababu nafikiria munaanza kulipwa kwanza mwezi huu, si ndio? Hii ni mwezi mpya, si ndio? So kama mutaanza kulipwa kwanza mwezi huu, anzeni kufanya tarmac. Let us make sure let us make sure that this eye camp is a success. And Bwana CS, also drugs. We get a lot of people who want to give us drugs for free. So can we find a way? I know government is looking for money, but when people want to give us things for free, whether it's medical camps, whether it's drugs, tuache hii mambo ya maduty ili vitu ingie, tusaidie watu wetu. Because if we put duty, if we put things, you know, I saw HIV drugs being stuck in the airport for so long because of controversy. What we need then is to find a way to work the way Lieutenant General Badi works. Within 7 days, we can do it. We can do it within 24 hours. We can do it within 48 hours. We should stop this thing of doing things over a long period of time. So, office yangu iko open. Wale ambao wanataka kusoma, let us get the data. Then we talk to the various arms of government. We send these community health workers to school so that they can elevate their education. Because in life, wajua Mungu amesema, binadamu ni kama mti. Ukipanda mbegu, ukitaka hiyo mti ilete matunda, lazima uendelee kuiweka fertilizer, weka maji, kuichunga, kuzungumza nayo. So we are forming a relationship. I want to say we love you very much. Continue the good work that you're doing. Muko na CS ambao amewapenda, ndio unaona amekutoka ofisi yake amekuja hapa. And COVID vaccinations, I hope all of you are vaccinated. And you're going to encourage our people. You know, there's a problem in COVID vaccinations. Watu wanaoga. How do we tell people to stop being scared and to go and get vaccinated? We need the uptake to go higher. So please, start with yourself. Make sure if you're not vaccinated, you get vaccinated, and then encourage others to go so that this country can move forward properly. Asanteni sana, Mungu awabariki.
Afya yetu, jukumu letu. Hiyo kura ya Esther Passaris mtanigawia kidogo, sinte? Asante Mama County. Waziri, tunakaribia sasa mwisho. Karibu tunaita County Secretary ambao ataita Deputy Director General, alafu wewe mgeni wetu wa heshima utatuambia, na tungependa sisi kushukuru wewe. Leo we have invited you here because of happiness, not because of problems, because of the policy directions that you've given us, Waziri, and because of the support. Waziri, mingi imesemwa. I just want to take this opportunity to recognize the health team. I would like the senior health management team just to stand up and say hi. Waziri, they work so hard. We have our deputy directors, Dr. Musa, who is the one in charge of all the hospitals and the health centers. We have deputy director, health for policy planning. Na amesha propose 350 million for next year's stipend. Na sasa vile bwana sisi alisema ataskuma, sasa sisi tumeshafanya yetu. We have also Dr. Ngunu was around, who is the one in charge of preventive promotive services. We have the division heads, Dr. Kibe, just say hi, Muli. We have Susan. We have Judy. Judy is the one that is in charge of the community health strategy. And we have very good data about community health strategy. Waziri, we have also the sub-county teams. I think that is enough. Thank you. So as ours is again to continue thanking you for that and to thank the team who are working so hard with the community health workers. Waziri, as you know, when we were doing the polio vaccination, out of 3.5 million children that were vaccinated in the whole country, 1 million was in Nairobi. The WHO will confirm to you that we surpassed our targets. We actually achieved 101%. And you know, at some point they were thinking that we had cooked the data. So they went on a verification. Na hiyo ndio kazi hawa community healthcare workers wamefanya. Wakati wa measles pia tumesurpass target yetu. Kwa sahi, Waziri, because of your support of vaccination to Nairobi, We also have done a lot of outreaches because that is the best way we found vaccines moving, Waziri. So thank you very much for that support. We have partnered with a lot of people. During the initial days of COVID-19, we did what is called Wheels for Life, which was a program to get women who are pregnant who are going to the hospitals. And we did it in partnership with Bolt. And it was even recognized by WHO because of as one of the innovative ways of mitigating effects of the COVID-19 pandemic, because during curfews, the informal settlements are insecure, the ambulances may not go in. So we had partnered with the Bolt because they have riders. Na our CHVs walitusaidia sana kwa sababu walikuwa na company yao wamama wazito to hospitals. And because when the rest of the other health facilities, especially in the private, the antenatal rate was going down by 40%, the consumption in the public sector and utilization was going up in Nairobi by 40% because of the community health workers. So waziri wamefanya kazi mingi sana, na we also want to thank them very much. So today is a very good day for them. And even now, because of the health facilities that we have opened, the eye camp that is going on, we've even had other partners such as Hava, ambao wanasema mama na Hava pia wanasafirisha. Saa zingine tuko na wagonjwa ambao wanakuja hospitali, especially wa mama, na kwa sababu maternity is completely free, sometimes they don't even have fare to go home. So you want to discharge someone from the hospital, but hawawezi enda nyumbani, tabidi tena watu wachange. So we have organizations that are helping us, and we have including the Wheels for Life. Now we have Hava that is also agreeing to do sponsorship for those mothers who want to be taken home for a whole month. So we continue to partner with the community healthcare workers to have these innovative ways. We are now doing the NHIF bio-registration. Waziri, out of the 326,000 households that were registered, 66,000 of them have already been enrolled into NHIF. And now with the office of the county commissioner and ourselves, pia tunaomba kama CHVs wanaweza pewa hii kazi ndio iende haraka zaidi, hii ya biometric registration. In Nairobi we have trained them digitally. This program was used by the World Food Program, and it is certified by the Ministry of Labor, Social Protection, Social Services, and it is the one that we have used. Vile County Commissioner alisema, we have used it to identify families that needed cash transfer. So with those very many remarks, I want now to invite Waziri Majevdia to invite the County Secretary, who in turn will invite the Deputy Director General and yourself, Waziri. Thank you. Afya yetu, jukumu letu, asanteni.
Dr. Luga, I now wish to call upon our CS, County Secretary, Dr. Jairus Musumba, to give his remarks and those of the Governor.
Afya yetu, jukumu letu. Waziri wetu wa afya Bwana Kagwe, Deputy Director General Bwana Kang'ethe Thuku, mama wa Nairobi Esther Passaris, waziri wa afya Majevdia, representative of UNICEF na wengine wote ambao tumewaheshimu na wasalimu kwa jina la Yesu. Habari zenu? Mimi hapa sijui nitasema nini kwa sababu mimi ni mwenyeji wa afya, hata kama saa hii mimi ni county secretary, lakini mimi nimetokelezea upande wa afya. Na vile imesemekana hapa, kabla nitoke afya, tumepigana sana kwa sababu ya hii act iweze kuwa gazetted. Na nilipoingia kwa ofisi ya county secretary, nililetewa kama acts 4 ambazo zilikuwa zimekaa sana bila without being gazetted, na nikafanya juu chini, kwa sababu huyu Judimu naona akisemekana ndiye mkubwa hii. Hata mimi nikiwa afya ndio niliangalia nikaona anaweza hii kazi, si ni kweli anaweza? Na nilipompa simeona ile maendeleo imefanyika. So mimi kwangu hapa ni furaha kubwa sana at personal level kwamba tumeweza kufikia pale tumefikia. Lakini kwa sababu siku ya leo si yangu, ni siku ya guest of honor ambaye ataongea baadaye, nimetumwa pia na gavana wetu, kaimu gavana wetu ambaye anaitwa Ann Kananu, na akanipa speech yake hapa niweze kuwasomea, ndio muweze kujua hata kama yeye ako kula ameenda, ako na sisi hapa. Angetaka sana kuwa hapa, lakini kazi imetokea kwingine ambapo ni lazima aende, na akanipa speech yake niweze kusoma. So nitaweza kusoma nikinukuu vile ameiandika. The Cabinet Secretary, Guest of Honor, Director General ambaye angekuwa hapa but represented by the Deputy Director General, partners who are here, all distinguished guests, ladies and gentlemen. It should have been good morning. I think it is good afternoon now. It is a great pleasure to be part of this launch of the Nairobi City Community Health Services Act 2019, an act of the County Assembly of Nairobi which gave effect to the provisions of Article 43, Section 1A of the Constitution of Kenya, and to provide for the establishment and delineation of community health units within the county for effective and efficient delivery of community-based health services and for connected purposes. It took 4 years, they have already talked about this, of hard labor and lobbying partners and the County Assembly Health Committee led by Honorable Warutere for this bill to be enacted into law. Therefore, today marks a special day as we officially unveil this document that will work towards improving the health and well-being of Nairobi residents, which is critical in achieving universal health coverage, delivery of quality and efficient basic health care services at the community level. Community health volunteers, mama wa Nairobi amesema sasa workers. So community health workers are a big part of ensuring we deliver services to Nairobi residents as they engage in tracing a referral of health-related cases to the nearest health facilities, conducting home visits to determine health situations, promoting appropriate health care for the sick with the support of health partners, Governor anasema we will also ensure an increment in the allocation. Governor amesema pia ile imeulizwa atafanya bidii ndio iweze kuongezeka. My government and staff is fully committed and dedicated to ensuring the act is fully implemented. Amesema lazima itafanyika, and we will make arrangement for the training and certification of health volunteers. Umesikia mama Nairobi akisema, kwa hivyo hata governor wanaelewana naye hapo. I will ensure protection of health and safety of all community health volunteers. Tumesema sasa your workers and community health services personnel in the county, as well as the creation of necessary institutional and coordination framework to encourage and facilitate voluntary provision of community health care services. We will engage the volunteers as well as our own. We will engage the volunteers as our own and use them to reach the grassroots. Kwa hivyo, Governor anasema anawakubali kama wake. I thank you and bless you. Continue keeping safe. Signed, Her Excellency Anne Kananu, Deputy Governor and Acting Governor, Nairobi. Kwa hivyo, hiyo ndio speech ya kaimu governor wetu, na kwa sababu ya time nitachukua jukumu hili kumkaribisha Deputy Director General Bwana Kang'ethe Thuku, naye akuje atuambie vile ametembea. Asanteni sana.
Afya yetu na jukumu letu. Mgeni wa heshima katika sherehe ya leo, Waziri Senator Mutahi Kagwe, aliko hapa wote, community health workers, all protocols observed. It is my pleasure to welcome you all to the launch of Nairobi Community Health Service Act. NMS is mandated to provide quality healthcare services that are accessible, equitable, and sustainable to the population of Nairobi Metropolis. In order to achieve this mission, NMS was greatly involved in the gazettement of Nairobi City County Community Health Service Act 2019, so as to establish the Level 1 service delivery, which links the community and health facilities. I commend the Directorate of Health for this great milestone. They work diligently at the grassroots level to deliver health care. Going forward, the NMS Community Health Strategy and community health workers will be more streamlined, more accountable, and more rewarding to them. This act will provide delineation and establishment of community health units within Nairobi City, so as to provide for effective delivery of health services. To mention a few statistics, the county has a coverage of 77%, that is 732 community health units, serving approximately 732,000 households, all in the informal settlement. This comprises 7,320 community health volunteers and 65 community health assistants as stroke officers. NMS recognizes the work of community health workers, especially in the COVID-19 response, in referring the client from the household to the 24 newly constructed health facilities in our informal settlement. We appreciate you for promoting health and for good health-seeking behaviors. Waziri Kagwe, our community health workers have managed to register over 326,000 indigent households, out of which 66 households are utilizing NHIF cover. This is no mean a feat. It is noteworthy that the list they generated was even utilized for World Food Program, as they embarked on supporting the vulnerable families through a cash transfer program to cushion them against economic effects of COVID-19 pandemic. Our community health workers have done a tremendous job so far. However, a lot more can be done when a platform is set where NMS is responsible for them and they are accountable to NMS. We have completed vetting our community health volunteers and entered into formal agreement with them to ensure they are motivated through a stipend. We thank Nairobi County Assembly for allocating 100 million to be used in the initial phase. We wish to request the Assembly to allocate more resources because the 100 million is not enough. And I want to thank them because they have promised to add more. In the past, NMS has paid the community health workers for the indigent registration activity through their link health facilities. And just for that, the activity, we spent about 25 million. I appreciate that a number of development partners are also willing to close the funding gaps for our community health strategy. We welcome the generosity and request that the money is channeled to a community health kitty or fund so that NMS can assure all our community health workers of equitable distribution. I also appreciate the national government for the policy directives. I appreciate the Nairobi County government for the support in ensuring we have an act in place, and our key partners in community health who continue to journey with us. We are proud of our community health workers and are thankful for their efforts to deliver health care to the most vulnerable in our society. May God bless community health workers. Thank you. Afya yetu, jukumu letu. Sasa ni jukumu langu na heshima yangu kumwalika mgeni wa heshima naye aje atuzungumzie. Karibu waziri, makofi. Tena funga, karibu.
Asanteni sana. Please be seated. Thank you very much. Asanteni sana viongozi wenzangu, wafanyikazi wote ambao wako hapa, wageni wote kwa ujumla, amjambo. Amjambo tena. Afya yetu, jukumu letu. Mungu asifiwe. Sasa mimi wajua sina mengi ya kuzungumza kwa sababu nimeketi hapa kama masaa mawili hivi na yeyote zote ambazo nilikuwa nataka kusema zimesemwa. Sasa si mimi vile nimesikia mambo ni machache. Ya kwanza ni kusema ya kwamba tumeshukuru sana na tuna furaha kubwa kwa sababu ya kupitisha hii act, the Nairobi City Community Health Services Act. Na nataka kushukuru Nairobi County Assembly kwa vile mmepitisha hii mswada. Kwa sababu it is one thing to depend on individuals and it is another to depend on institutions. We cannot rely on the goodness of man or woman for that matter to protect our workers. But in law, once it is in law, then we are protecting our workers through the law. Na sijui kama nyinyi mnaelewa ni kitu gani imefanyika leo hii. Hii kitu mnaona nikishika hapa, this is the Kenya Gazette Supplement. Hii ndio sheria yenyewe. Na hii kitu ni muhimu jameni. Na hii kitu itamsaidia nyinyi sana, sana, sana. Kwa hivyo nataka kumshukuru Bwana Piers Mwaura. Congratulations my brother. Mheshimiwa, congratulations. Chairman wako Bwana Warutere, congratulations. Na ujumla Nairobi City County Assembly, I want to praise you and I want to congratulate you for really coming to the aid of our workers, recognizing the importance of our community health volunteers, appreciating the work that they do, kwa sababu hii ni mwanzo mzuri sana. Ya pili ni kusema ya kwamba nyinyi sasa mkitaka kuitwa volunteer ni sawa, mkitaka kuitwa worker ni sawa. Mimi ni nani nikatae? Lakini mnajua volunteer, let me tell you, there is something special about a volunteer. This is a person who takes it from their own hearts. Ni kutoka hapa. Sio tumbo. Kuna mtu anatoa hapa na kuna mtu anatoa hapa kwa roho. Nyinyi mnajitolea kwa sababu ya upendo wenu binafsi. Kwa hivyo chochote mnachoitwa, nyinyi ni watu wazuri. That is the main thing. That is the long and short of it. Kwa hivyo, I asked my sister Esther Passaris, who I have worked with tirelessly in the Committee of Health, and Esther, through you, I also want to thank the National Assembly for passing the NHIF bill. I hope that the Senate will also do the same thing. Na yale ambao Mheshimiwa Passaris amesema, sana sana hiyo mambo ya macho. Watu ambao wana shida za macho, tafadhalini assist in this process so that we can make sure as many of our people as possible are able to see. You know, one of the challenges of the Kenyan health sector, it is people who are not health seeking. So we want to improve on what we are calling the health seeking behavior of our people. We want to make sure that when a person is feeling unwell, they go and see the doctors as quickly as possible. Wale watu ambao wanaweza kusaidia in changing Kenyans so that they develop a health-seeking behavior pattern is yourselves. Nyinyi ndio mnaweza kutusaidia so that somebody with malaria hakai nyumbani mpaka hiyo malaria inazidi, alafu kwenda hospitali is too late. You can identify them yourselves. Instead of a mother going to hospital to deliver and she has been having problems for 2 days, so that the maternal mortality rate is increasing, you are the people who can help us. Instead of a person staying at home with signs that they could have cancer, if we detect it early, we can save that person. But you are the person who can help us to do that. Kwa hivyo nyinyi mna kazi kubwa. You have got a lot of work. Esther mentioned about the UK. I can tell you about Cuba. In Cuba, the community health volunteer is the most important health worker. Sio daktari, sio nimeshile wala kwa kule hospitali, it is the community person. Yule ambao anatembelea kina mama na kina wazee kuangalia huko nyumbani. And going forward, what I would propose, Bwana Kangethe, when my brother Bandi comes back, one of the things to do is to ensure that all our workers are connected to a health facility. Kwa sababu saa ingine, there is no connectivity between a health facility and a community health worker. What we want to do is that as we register the health workers, and Bwana Oluga, you are doing a good job, what we would like to see is 2 things. Number 1, if we are registering NHIF people via biometric registration, and to avoid the problem of identifying our community health workers, we should register them biometrically as well. As Esther said, you should be able to go to a computer immediately and see the picture. Unaona huyu ni Judy, ako hapa, anafanya kazi Kibera. Na huyu ni Atieno, ako hapa, na huyu ni Kamau, anafanya kazi Gomongo. So that we know exactly who it is with their photos and everything. That should be easy. There is nothing complicated about that. Mimi ni mtu wa ICT, naelewa hiyo. It is an easy job and it helps us so much. The second thing is to ensure that the training that we are talking about, sio ile training tu ya siku mbili, alafu mtu anaambiwa ingia uwaja. We want you people to be properly trained. Hii training sio training na kupatiwa ka notebook. Hapana, unafanywa training, unapatiwa a smart mobile phone. Ndio uweze kufanya records so that when you treat somebody, unaweka hapo dakika moja hiyo data inaenda mara moja kwa Oluga, Oluga anajua afanye nini. Ama jamani, nyinyi mnaona namna gani? Sio ndio ukweli? Because the world has moved on. Dunia imeendelea. Hii mambo ya big pen na ka notebook na makaratasi ile naona watu wakibeba, hiyo imekwisha. That's gone. So kwa hivyo mimi ningewasihi wale ambao wanafanya budgets, and I want to say a special request to our development partners, and I want to say a special thank you to UNICEF. I know how Maniza has been working, I know how my brother here has been working, but I want us to take it further. We use Nairobi as a pilot project to use our community health workers and volunteers to develop data on all our people and the community at large. And that we can do. There is no reason at all why we cannot do that. But the third thing I also want to propose is that moving forward, you also become our agents of hygiene and primary health care. Ile mambo ya usafi jameni. Kwa sababu through COVID-19, we have seen the impact of hygiene and cleanliness. The disease burden has reduced dramatically. Mimi kwanza mwaka huu hatujasikia mambo ya cholera. Kwa sababu gani? Kwa sababu ya kunawa mkono na kuwa safi. That is why. And who has made that happen? Nyinyi wenyewe. Jipigieni makofi jameni. And so we want to make sure that you are also trained in the area of ensuring that communities are clean. Wajua jameni, you know, people don't link seeing dirt in the streets with their health. They don't see the relationship. That there is a direct relationship between uncollected garbage and your children's health. Manake mtu ambaye hanawi mkono, let me take you through a small story. Mtu anaenda hapa South France. Anaenda kwa soko. Ameenda show, hajanawa mkono ama chochote. Anaenda anashika mboga. No sanitizing, nothing. Anashika mboga. Wewe mama kwanza he weighs it. Anachoka hii uzito iko namna gani? Anaipeleka kama mpira. Anaona hiyo uzito ni mzuri, bas. Hapana, hiyo anaasha. Wewe mama unakuja, unachukua ile mboga. Unapeleka nyumbani. Kabla hujapeleka nyumbani unamwambia mtoto, pelekea hii Wanjiro akupikie. Mtoto anachukua ile mboga. Unaona hiyo picture unaiona? Unaona hiyo hadithi? Anashika hiyo mboga, anaipeleka, lakini kabla hajaipeleka isafishwe ama ipikwe, yeye anarudi kucheza na wengine. Anaanza kula mkono. You can see the picture now. Sasa yeye hiyo kitu yote ameweka kwa mdomo. Wewe saa hiyo kufika usiku 8, mtoto wako na problem ya tumbo. Wewe sasa unaanza kukibizana na mahospitali. Badala ya kulala, wewe sasa uko pale Kebra, ile hospitali mpya tulifungua. Umeingia huko ni saa 8, umezungushwa hapo kidogo, saa 11 unarudi nyumbani. Unaingia nyumbani, uko na usingizi, unataka kulala saa 1 ndio uweze kwenda kazini. Usingizi unakuzidi, ukiangalia saa ni saa 4. Unaenda kazini, umefutwa kazi. Sasa wewe umefutwa kazi kwa nini? Kwa sababu ya yule mtu ambaye hakufanya nini? Mnaona hiyo hadithi yetu? So jameni, you must see the link between hygiene and our well-being as a country. And I want you to be on the front line. Community health workers and volunteers na wengineo. Please, we must be on the front line. We must teach our people the relationship between cleanliness and our health. Na ndio sababu tunataka kuanza hii mradi wa the cleanest county in the country, to introduce a cleanliness index, because we have seen the importance of being clean. Hiyo ndio inaweza saidia watu wengi sana sana katika nchi yetu ya Kenya. Kwa hivyo hata wale wako nyumba 10, in addition to security, think of security, think of health as a security issue. Kwa sababu mtu ambaye ni mgonjwa hakuna kitu nyingine anaelewa. Health is very personal. And if the person is not well, if the person is not healthy, other issues do not arise. So health is also a security issue. And our nyumba 10 people should also participate in this. We are also want to urge and are working with the Ministry of Education to make sure that the issues of health and hygiene are an integral part of our education at a very young age. Because that way we can help our children in the future. I am told that Nairobi has about 7,000, I think is Bwana Kang'ethe amesema, 7,350, something like that. That's a lot of people. They can have a big impact if we train them properly, like I said, but also, ni lazima tuseme, tukilia pamoja, tunakula pamoja. Si ndio? Yaani hiyo ni kusema nini? Ni kusema mlipwe. Ni kusema kama tunafanya kazi pamoja, ni lazima pia tukule pamoja. Kama tunalia pamoja, ni lazima pia tukule pamoja. Si ndio jameni? So I would like to urge and really ask counties, those counties that are not, like Dirango said, those counties that are not paying, that are not at least giving something to the community workers, to begin to do so. Kwa sababu ile kazi wanafanya, wewe utafanya. Kama hutafanya, si basi pesa zipelekwe wakati pahali kazi inafanyika. So I want to appeal to our development partners and ask you, when you think about where to put support for the health sector, we as a ministry will support that our partners focus on community health workers. Kwa hivyo, those people we are working with, wale ambao wanajenga manyumba, mahospitali, sasa tumejenga majumba mengi sana hapa Nairobi. Buildings alone are not healthcare. Nyumba yenyewe haiwezi kutimbia mtu. Ni hawa ambao wanatusaidia. Kwa hivyo, manyumba sisi tunajenga, lakini sisi saidieni sisi na hawa watu. In the area of training, in the area of equipping, particularly in that area of equipping, and giving them facilities that are going to allow them to build data and to build records as far as their patients and the clients they are dealing with are concerned. Ya mwisho kabisa, wacha nizungumzia kidogo mambo ya vaccines. Sisi tungetaka nyinyi mtusaidie na hii mambo ya vaccine. Because we have not been sufficiently vaccinated, leo hii tumeongeza na siku 30 the measures ambayo ile masharti ambayo tumeweka ndio tuweze kupigana na hii virus. We have extended the measures for at least another 30 days to allow ourselves two things. We have extended the measures of the curfews and others for 30 days so that we vaccinate as many people as possible. Na wale ambao wanaweza kutusaidia hiyo safari ni nyinyi pia. Si ndio? We want to make sure that we save Kenyans. The job of saving Kenyans si ya Mutahi Kagwe peke yake, si ya Rais Uhuru Kenyatta peke yake, ijapokuwa angetaka kufanya hivyo leo hii. Lakini it is every Kenyan must take responsibility for saving themselves. Every Kenyan. But we want you to assist them in seeing through and thinking through. Ukiwa wewe, you are over 50 years old. I want you to appreciate that you are threatened. If you are more than 50 years old, you are threatened. And because you are threatened, your children are threatened. Sana sana kina mama. Because when you are not there, and your children are 5, 10 years old, tuko na shida. You know that, I know that, we all know that. Hakuna kufishana. Kwa hivyo, jameni, I want to urge you as our community health workers to ensure that where you go, wakati unatembea nyumba hizo, wewe unaenda, waulize kwanza if they have been vaccinated. And if they have not been vaccinated, let's develop a plan. Nairobi has got a very good spread. I know that most of you are trained in this area of vaccinations, so that we ensure that all our citizens, the eligible citizens, have all been vaccinated. That way, by Mashujaa Day, we want to have at least 5 million doses. 5 million doses in Nairobi, around the country, so that we have got 5 million doses that have been used, then we know we are moving on to herd immunity. We thank God that even though we have kept our schools open, we have not seen fatalities amongst our children, or very few if at all, and for that we are grateful. Lakini walimu is where the rubber meets the road. So we want to make sure that our teachers are also all vaccinated, because it is you who is exposed, and consequently, you expose the children. So, wenzangu, mimi yangu ni kuwashukuru tu, and to urge, ile mambo nimesikia, kuna wimbo moja nimesikia hapa, umeimbwa, hata mimi nilikuwa karibu kuimba, wakasema sisi volunteers, tumechoka kuvolunteer. Hapana. Hebu nimweleze jameni. There is work and there is a calling. This is a calling. You can never be tired of a calling. Kwa hivyo, vile mungeimba, ni kwamba tunataka kausaidizi, ndio hii volunteering iwe tamu. Hiyo wimbo mugeuze kidogo, museme, museme sisi wa volunteer, tuongeze kitu kidogo, ndio volunteer unakuwa tamu. I can even write for you the song so that so that the song becomes even better. Ama namna gani? So my friends, I am asking on your behalf. Mimi ni community health worker number 1. Mimi. Kwa hivyo ningetaka kuwasihi all counties, as I close my remarks, I would like all counties to pass a bill similar to this one, so that you can be protected, so that we can protect our workers. We pass a bill like this one. The second thing is the same county assemblies, all counties, to pass a bill that leaves all money collected in hospitals, leave that money in the hospitals, so that they can be able to buy medicines. Kwa sababu, the experience we have got is that those counties that have passed the bill to allow for money collected from hospitals to stay in hospitals are doing better than the ones who have not. Kwa sababu, vile kunafanyika ni kwamba, watu wanaenda hospitali, wanalipa pesa kidogo, hiyo pesa inapelekwa county government treasury. Ile ingine inatoka NHIF, pia inapelekwa treasury ya county. Alafu sasa watu wanasema hapa hakuna barabara. Badala ya pesa kupelekwa kwa hospitali, kununua madawa, sasa unaona hiyo imeenda kujenga barabara. And I'm all for building roads. Lakini, nikiwa naumwa na tumbo, afadhali niende kwa Maram, na niwe hakuna siumwi na tumbo, badala ya tamak ambao naumwa na tumbo natapika. Ama namna gani jameni? Would you want otherwise yourself? So please, let's pass the bills. Within the county assemblies, let's pass the bills to protect funds, ring fence the funds that are for health to stay in health. Pass a bill to protect our community health workers and to institutionalize their work within the counties. Ukifanya hizo, and finally, our watu jameni, walipe. Pay them so that they can be enthused, so that they can be encouraged. As a national government, I promise you, we are going to do everything that we can to ensure that that is the case. On the issue of training, again, I want to respond. Kabisa. Kabisa. Wajua kuna watu wanataka kusabotage, wajua nataka kumwambia. Kwanza mambo ya pesa kuna watu wataki niseme. Nitoboe. Unaona wamerudisha kwa sababu yenu. So kwa hivyo what I want to say is that the training, indeed it is true, we have signed an agreement with the government of the United Kingdom so that they can take our extra health trained nurses. We have also in the process of signing agreements with very many other governments, not just for nurses, but for extra workers that we have got in all fields. My focus is health, but there are some others. For example, the UK is looking for truck drivers. Na hapa unafikiri hatuwezi kuwapatia truck drivers. So as a policy, I know that the government is intent on creating as much opportunities as we can for our young people and for our workers in this country. So the training, Mheshimiwa, that you refer to is crucial. And I agree with you that we must find a way of ensuring that our community health workers and volunteers are also part of that process, so that those of you who are qualified and can train up can go and work in the UK and elsewhere. Kwani nyinyi hamgependi kupatiwa pounds instead of shillings? Si ndio? So we work closely with the county governments to ensure that we create opportunities and we give as many opportunities to as many people as we can. Kwa hivyo machache, I want now to declare the launch of the Nairobi City Community Health Services Act 2019 officially launched. Sijui kama naona naitwa huko, nikuje huko. Lakini tuko mamoja jameni. Are we together? Na hii kitu hata nyinyi, when you are protecting people, you also protect yourself. Kwa sababu nilisema you can get it. Can you get it? You can get it. I can get it. And if we treat this disease normally, it will treat us. Asanteni sana.
Tusonge nyuma kabisa kwanza. 1 2 1 2 1 2. Haya basi, tunataka kukaribisha sasa the CS and the entire team that are here. Wakuje tu polepole kwanza. Tafadhali watu wa kamera tukae vizuri ili wenzenyu pia wapate nafasi. Asante sana. Akiwa anafungua kwa launch kabisa. Asante sana. Makofi tafadhali. Makofi tafadhali. Kenya Gazette Supplement Nairobi County Act 2019. Asante sana. Tuwasonge mbele kidogo pale. Mheshimiwa Pasaris. Tafadhali watu wa press tusonge nyuma kidogo, kuna wenzenyu pale nyuma. Thank you tafadhali. Sawa sawa. Thank you so much. Haya, picha mzuri kabisa. Yes. Thank you, thank you. Basi watu wa community health workers mrudi nyuma nyote. Tusonge nyuma sasa. Sorry madam. Madam, come back. Songeni nyuma kabisa. Kuna jambo bado tuko naye hapo. Baada ya hiyo picha tutakuwa na official ya njia ya kukata keki ya siku ya leo, and all the health workers will be side. Mutachukua keki mkigao ya watu, na kutoka hapo tafunga. Basi kila mtu rudi nyuma kidogo. Thank you so much. Tusifunge karibu na keki. Asante sana. Thank you so much. Ninaona mheshimiwa tayari ameshanawa mkono na sanitizer mzuri. Hata kisu hiyo iwekwe sanitizer. Vizuri kabisa. Thank you so much. Yes. Haya, asante sana. Pale sasa mheshimiwa ndio huyo wakiwa na wenzake. Tafadhali tusifunge. Very good. Aha, sawa sawa, ndio hiyo keki inakatwa. Kata kata. Kata kata. Kata Mutahi kata. Kata kata. Kata kata. Haya basi, tuko sawa kabisa. Keki ndio hiyo imekatwa, na tunapenda sasa tupige hatua ya miguu tena 3 nyuma. Miguu 3 nyuma. Watu wetu wa press, tafadhali. We thank you. Let us turudi nyuma kidogo. Turudi nyuma kidogo. Hey, watu wa press hawa. Rudi nyuma kidogo. Kwa sababu ya COVID. Yes. Aya sasa. Yes, songeni basi nyuma, health worker. Songeni nyuma kidogo. Bwana, wacha watu. Excuse me. Songeni hapa. Health workers. Health workers, kujeni hapa na mpange line. Pange line. Pange line ndio hiyo. Moja moja. Mheshimiwa akipeana akikuja. Mwache nafasi, mwache nafasi. Ni nafasi. Mheshimiwa tembea ukikuja namna hiyo. Songeni. Songeni. Songeni, mheshimiwa anakuja namna hiyo. Thank you so much. Asante sana mheshimiwa Kagwe. Thank you. Asante. Pole pole, msisukumane. Haya basi, health workers, sisi wote tusonge nyuma pale. Tusonge nyuma sasa kabisa. Nataka sasa karibu na pale tumekata keki. We want to close our function. Mheshimiwa, tusimame hapa. Tunataka kuimba wimbo yetu ya taifa. Hapa Just Levat is here. Levat. Now we want to close the ceremony now. Yeah, we stand here because we want to national anthem. Haya, tafadhali tusonge nyuma sasa. Songa kabisa. Songa nyuma. Please. Karibu pale. Thank you. Haya basi, ningeomba kila mtu ambaye wako kwa kiwanja hii tusimame. Kila mtu ambaye yuko kwa kiwanja tusimame. Na tuwe na heshima. Mama huyu wanapiga picha, nimesema simama. Stand up. Everybody stand up. Kuna pali tunataka order. And right now, ukiwa na kofia ambayo sio ya kiserikali, fua. Haya, saa hii ni kupata wimbo ya taifa ambayo imebeba pia maombi yetu ya leo, na kikundi yetu itakuwa imeisha. Please proceed. Basi kwa muda hiyo tungeomba kwa watu wetu wote, mkiwa mmesimama namna hiyo, viongozi wetu watatoka kwa polepole kabisa, tusiwasukume. Basi kwa wale watu wetu walikuwa kwa dais, they will be going to a certain point at Tamarid to sign a document.
The vote of thanks, as a community, nothing is imagine the program yetu. Sasa tumefanya shughuli hapa, hakuna mabisi. Sure.